Hi, I'm Ryan Nutter, CEO and Principal of Cornerstone Senior Advisors, and as we say all the time in the office, Medicare is the air we breathe. In this video, I want to talk with you a little bit about a Plan F. What's going on with the Plan F? How does a Plan F work? What does it look like with Medicare? But before we dialogue about the Plan F, I just want to talk a little bit about Medicare, what Medicare is, what Medicare covers, and maybe more importantly, what it doesn't cover and why we need a Plan F, just to understand this purpose that a Plan F serves. So when we talk about Medicare, there's really two parts, Part A and Part B. That makes up original Medicare. Part A of Medicare is your hospitalization. So all these years you've been working, and they're pulling money out of your paycheck for taxes, the portion of your taxes that went towards Medicare paid for Part A. So Part A has already been paid for, it's already been bought. I never tell anybody Part A is free because it absolutely was not free. You absolutely paid for Part A of Medicare, it's just that it's already been paid for, it's already been bought. So going forward, you turn 65, you're entitled to Medicare, you sign up, you get Part A, there's no premium going forward because it's already been paid for and it's your hospitalization. So what does it cover? Part A of Medicare, day one, when you're admitted to a hospital, you have a $1,600 deductible. That's your hospital deductible. Now that deductible will cover you for up to 60 days. The catch with this deductible is it's not annual. So if you're admitted to a hospital, you pay that $1,600, you're there for a few days, you go home, 2 months later you're back in the hospital, you have to pay this deductible again. It's not an annual deductible. So you could pay that deductible several times in a year if it's a rough year health-wise for you. Now, if you're in the hospital for over 60 days, then you begin to have a per day copay of $400. And if you're in there for over 90 days, that per day copay doubles to $800. Skilled nursing is also under Part A of Medicare. Skilled nursing is not the same thing as a nursing home. Medicare does not cover long-term care. What a skilled nursing facility is it's basically a place to recover. So if you've had a life event, a heart attack, a stroke, or let's say you had a hip replaced, your doctor says you're stable, but you're not quite ready to go home yet, oftentimes they're going to send you to a skilled nursing facility basically to recover. So this is where you're going to have registered nurses taking care of you. You'll have some physical therapy, speech therapy, occupational therapy, so on and so forth until you're ready to go home. Medicare fits the bill for the first 20 days. So you pay nothing for the first 20 days in a skilled nursing facility. However, after 20 days, now you have another per day copay of $200 for each day that you're in that skilled nursing facility. That's a little bit about your exposure with Part A of Medicare. Now let's talk about Part B. And to start, Part B does have a premium that you have to pay. It's $164.90 each month. Now, if you're drawing Social Security, they're just going to take that $164.90 out of your Social Security check automatically. They're not even going to ask you otherwise. If you're not drawing Social Security, then you are going to pay quarterly. So take that $164.90 times 3, and that's what you're going to be paying every 3 months. I also want to mention with this Part B premium, it says standard premium right here because it can be higher based on income. Medicare is going to look at your income from 2 years prior. We're filming this in 2023. This is your Part B premium in 2023. But if your income in 2021, depending on where your income level was, you can pay more based on your income. If you're worried you might end up having to pay more for your Part B premium, just give our office a call, 316-260-3331. We can walk you through what income level, income bracket you might fall into and what premium you may end up having to pay. But for most people, the standard premium is $164.90 a month. That's your first out of pocket with Medicare. So what's Part B cover? It's everything outside the hospital. So primary care doctor, specialists, emergency room, outpatient procedures even. Outside of the hospital falls under Part B, and it has a deductible, its own deductible of $226. This is different from your hospital deductible because it's annual. So you're just paying that $226 one time a year. Once that's been paid, well, now Medicare is going to kick in. They're going to pay 80%, and you're going to pay the remaining 20%. The biggest issue with Part B of Medicare is you have no max out of pocket. So these 20%, anytime you go to a primary care doctor, a specialist, an emergency room, you're paying 20%. You have an outpatient procedure, you're paying 20%. And if you end up with some type of a health condition where you're going in for regular and scheduled treatment of some kind, you're going to keep paying that 20%, and there's no ceiling. There's no max out of pocket. So you don't have any stop loss to stop your out-of-pocket exposure in a given year. All of these costs that we've been looking at that you're left with, this is why people get a Medicare Supplement Plan. They're also called Medigap policies because we're filling the gaps of Medicare. So what the government did is they designed this chart of 10 Medicare supplement plans. And they tell all these private insurance companies, if you want to offer a supplement to Medicare, you can, but it has to be one of these 10 plans. So these companies can't make up their own supplement to Medicare. They can decide which of these 10 plans they'd like to offer, and then they can decide how much premium they want to charge. But coverage-wise, it's all the same. Now the Plan F, right here, it doesn't matter what company you get that from, plan company D or A or B or C, they all have to abide by the government's rules. They all have to pay the way that Plan F was designed to pay and cover how that Plan F was designed to cover. That's why it's so important to work with an independent agency like Cornerstone Senior Advisors, because we're not tied to any one company or a bottom line or any one plan. We can walk you through all your options. We can look at Plan Fs in your area. We can tell you how many companies, what companies offer the Plan F, and what premium they charge. We really work for you and are on the same side of the aisle as you. So that's something we can walk you through. We can share all of your options with you. Now, Plan F, when you combine a Plan F with Medicare, this is what it looks like. This is your out-of-pocket exposure. So if you're admitted to a hospital, that Plan F is going to pay this deductible for you every time. Your per-day copays, the $400 to $800, even your skilled nursing copay down here, that $200 per day, those are covered for you. So the long and short is when you combine a Plan F with Medicare and you end up admitted to a hospital, all you're going to receive in the mail is a statement of benefits paid. I mean, it's dynamite coverage. And then outside of the hospital, this deductible for you, this annual deductible of $226, it's paid. And your 20% out-of-pocket exposure, all of that is paid. When you combine a Plan F with Medicare, anything Medicare covers, that Plan F is going to help out on. The rule of thumb is if Medicare pays, the Plan F has to pay. And it's going to pick up every part of the bill that's remaining. So all you're going to receive in the mail is a statement of benefits paid. Now, what's going on with the Plan F? Because we've heard it's no longer available, or maybe I can't keep it, or it's just not an option. What happened is the government decided to discontinue the Plan F for any new Medicare beneficiaries as of January 1, 2020 and going forward. So anybody that's new to Medicare, if you're turning 65, if you're entitled to Medicare was after January 1, 2020, the Plan F is not an option. The Plan G, if you want to go watch our video on the Plan G, it's now the most popular plan and offers the most coverage, and it's replaced the Plan F as the most popular plan. Prior to 2020, people would walk into my office, they just say, I want a Plan F. I mean, that's just what everybody was wanting. It's what they were going with. Well, now it's not an option to anybody that's new to Medicare after 2020. However, if you were entitled to Medicare prior to January 1 of 2020, the Plan F is still an option for you. So whether you have a different supplemental plan, whether you have an Advantage plan, maybe you still have a Plan F, you can still shop those plans. You can still sign up with a Plan F. You can look at different companies offering that Plan F, look and see what premiums they're charging, things like that. Because if you were entitled to Medicare prior to 2020, you still have an option of signing up with the Plan F. And again, we can help you know your options. We can walk you through all the different companies that offer the plan and what premiums they charge. Hopefully this was helpful for you and you understand a little bit more of what's going on with the Plan F. I do also want to mention, if you want a free copy of my book, Medicare Made Simple, just give our office a call, 316-260-3331. Call us today, request a free copy, we'll ship it to you. You don't have to pay anything for it. It's free of charge, and it's gonna break a lot of things down, what Medicare is, what Medicare covers, what these supplemental plans are. It'll break down the F, the G, the Plan N, so on and so forth, Medicare Advantage plans, drug plans. So chapter by chapter, we just walk you through in a real, hopefully simple way for you to understand all these different options. So if you have any more questions, please don't hesitate to reach out. We want to be a guide for you. We want to be a Medicare resource for you. Give us a call today, 316-260-3331. We'd be more than happy to help. Thank you for watching.